Hi, my name is Jennifer Hudman. I'm going to start off with writing down. Here's a blank piece of paper. There's nothing in my notebook. No notes or anything. I'm going to start off with just taking some, jotting down some notes real fast. Color, then I'm going to do this as pulses also. Narrow, detail, close, Okay, so done writing my notes. So now we're going to begin. I will approach with the patient. Prior to entering to working with the patient, I'm going to wash my hands with hand sanitizer. Okay. Hi, sir. My name is Jennifer. How are you doing today?
I'm doing well.
And what's your name?
John. John.
John. And can I have your birthday, John?
10/13/79.
Okay. And how are you feeling? What are you in today for?
Routine check-in.
Okay. And I'm just going to ask you a couple of questions to start off. Before we get into the physical assessment, I'm going to do a past medical history and just kind of how you're doing. So tell me, you said you're feeling good, you're feeling well. Can you tell me about any traumas or illnesses you've had in the past?
No.
No, you don't have any health conditions that you know about straight off the bat?
No.
Okay, so let's talk about allergies. Are you allergic to anything?
No.
Do you have any medication allergies?
No.
Food allergies?
No.
No. Any seasonal allergies?
No.
No. Okay, good. And you're not taking any medications, no over-the-counter things?
Vitamins.
Okay,
in the morning.
what kind of vitamins do you take?
Men's Health 1 a day.
Okay, and that's it, nothing else?
Omega-3.
And omega-3, okay. All right, so I'm gonna ask you a little bit about your past medical history. You just said you don't have any health conditions that you know of. What about your parents? Do your parents have any health conditions that you know of?
No.
Your mom doesn't have any high blood pressure, cholesterol, nothing like that?
No.
What about your dad?
No.
Not that you know of? Okay, we're gonna go into, what about your mom's parents? So your grandparents on your mother's side. Does your grandma on your mom's side have any health conditions?
No, not that I'm aware of.
Not that you know. What about your grandpa on your mom's side?
No, not that I'm aware of.
Okay. What about your dad? What about his parents?
Deceased.
Okay. Do you know why they were deceased?
Liver disease. He died of liver disease and old age.
Okay. So which one was the liver disease? Your dad's
Dad's dead.
dad died of liver disease. Was he drinker, alcohol?
Yes.
Okay. So he did drink alcohol. Was it quite a bit?
Yes.
Okay, so you did have some alcoholism on his side. But your dad doesn't have anything, your mom doesn't have anything, her side doesn't have anything, right?
No.
And both your mom's parents are still living?
Yeah. No.
No? Okay. On your mom's side, who's deceased?
Grandpa's died.
Okay.
Grandma's not dead, but dying. They're old.
Do you know what your grandfather died of?
Old age.
Old age. Okay, so they didn't diagnose him with anything, he just,
They just get old and they die.
okay, how old was he when he died?
89.
And how old was your dad's dad when he passed?
60.
And how old was your dad's mom when she passed?
70, 82.
82. Okay. Okay. Well, that's some pretty good years. Do you use any sort of tobacco products?
No.
No smoking, no chewing tobacco, smokeless, no vapor, vaping, nothing like that?
No.
Okay. Do you drink any alcohol?
Yes.
Okay. How often do you drink alcohol?
Socially, twice a week.
Twice a week. Okay. So 2 days a week you drink alcohol. About how many drinks do you have?
2.
So 2 drinks twice a week. So 4 drinks a week?
Yes.
Okay. All right. And that's every week?
Yes.
All right. Do you, so you don't smoke, you don't drink. Do you use any recreational drugs, like marijuana, cocaine, heroin?
No.
Anything like that? Okay, good. So tell me, are you employed?
Yes.
You are. What do you do?
Construction.
Oh, that sounds fun. Are you outside a lot, around a lot of dust and debris?
Yes, I wear my PPE.
Okay, what is a PPE?
It's safety equipment.
So tell me, what kind of safety equipment do you use?
Harnesses, masks, glasses, ear protection, and gloves.
So you do wear a face mask when you're out there?
Yes.
Good. Okay. So your construction worker, are you married, single?
Married.
Okay. And do you have any children?
Yes.
You do. How many children do you have?
1.
Okay. And you all live together in the same home?
Yes.
Good. All right. So I'm going to ask you a little bit. Have you ever had? Are you up to date on your vaccinations?
I don't do vaccinations.
None at all.
None at all.
So did you get childhood vaccinations?
I believe that I did. I'm not sure.
You're not sure. So you think you got them in your childhood, but you haven't had any recently. So
Not since I was 18.
Okay, so not since you're 18. So no flu vaccine, no pneumonia,
No.
nothing like that, no meningitis, right?
No.
Can you tell me why you don't get vaccinated?
I don't choose to. Choice.
Just because? You
Yes.
just don't want to?
Pure choice.
Okay. Okay. Well, so vaccines can help protect against certain illnesses like the flu and pneumonia and meningitis. They can, if you do get the flu, sometimes it's the symptoms are less. when you have the vaccine as opposed to if you did not have the vaccine. So it is encouraged that you do get a flu vaccine once a year. It can help protect against colds and things as well. So something to think about, the flu vaccine and the pneumonia vaccine and meningitis vaccination. They do have some merit, right? They are useful for some things. So, so do you have any, any shortness of breath, any breathing problems at this time?
No.
No? Any vision or hearing problems?
No.
No. Okay. Any problems smelling?
No.
No. Any congestion, pain, pressure in your head?
No.
No. All right, good. Do you have any cardiac conditions?
Not that I'm aware of.
Not that you're aware of. So never diagnosed with high blood pressure or anything like that?
No, not that I'm aware of.
Okay, good. No peripheral vascular disease, nothing like that? No coldness in your feet or your hands? Swelling? No. Okay. So have you ever been diagnosed with a breathing problem, asthma, COPD, sleep apnea, anything like that?
No.
Good, 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 good. Okay. Have you ever been diagnosed with any lymph or endocrine problems like diabetes or hypothyroidism or anything like that?
No.
Anemia? Nothing?
Nothing.
Okay, good. All right. What about musculoskeletal problems? Do you have any limited range of motion, any soreness, weakness, tingling in your extremities or your muscles?
No.
Good. That's very good. Do you have, are you sexually active?
No.
Okay, so you're married but not sexually active.
Correct.
Okay, is there a reason why?
Don't choose. It's choice.
It's choice, so you don't have any sort of dysfunction or problems, lack of libido?
No.
So sometimes when we're not sexually active, it can mean that you have health conditions. Sometimes cardiac conditions can affect, can cause erectile dysfunction. Low testosterone levels can cause a lack of libido, sometimes stress, things like that. So it is important, you know, sex is a healthy and stress relieving activity. So, and if you're having problems there, it might be signs that you're having problems somewhere else in your body. So I do recommend that you get screened for your testosterone level, and we're going to check out your heart and stuff now today, okay?
Check out my unit.
So we're going to check out your heart. Okay, yes, we're going to check out your heart. Okay, so are you having pain anywhere in your body?
No.
No pain at all anywhere?
No.
Great, perfect. All right, so let's get started. We're going to start in on the physical part of the exam. So I'm going to start off by, I'm going to be feeling and touching your head and scalp. I'm going to look at your hair. So I'm just going to touch his hair. I'm going to look for any bruises or bumps. I'm going to look for any pests, lice or anything like that. I'm going to look for any lesions, scars, showing any past histories, surgeries or something like that. So he does have a little bit of graying in his hair. Just here on the sides, it doesn't look patchy or anything like that. So I don't notice any moles, any bumps, bruises in his scalp. His hair is, he doesn't have any patches or hair loss. It's thick and healthy looking hair, not oily or dry or brittle. I'm going to look at his face. So your face, if you turn to me, your face looks symmetrical, right? I don't see any bumps, bruises, lesions on the face. It looks to be rather symmetrical and sizing is appropriate. Turn your head this way. Okay, and turn, look over here. Look at my finger. Okay, look at the midline, straight up, and down to your chest. Good, so your neck is, range of motion is good. So next I'm going to palpate your sinuses. So I'm going to touch the sinuses here. I'm going to touch the frontal sinuses. Tell me, do you have any pressure, pain?
No.
Tenderness here in the maxillary sinuses?
No.
Okay, good. So I'm going to, next we're going to check out your eyes. So I'm going to take a look at your eyes. So I'm going to grab my pen light. I've got my supplies right here. Right, my gloves, all my tape, all my stuff right here. So I'm going to start off with the pupillary reflex. So I'm going to check it on both sides. So I'm just going to shine a light. Okay, look straight at me. Good. So his pupils are reacting on both sides symmetrically. When I shine the light over here, both pupils constrict. When I shine the light over here, both pupils constrict. Take a look at me. I'm going to look at the outside of the eye. His sclera do look white. They look good. I'm going to pull down here. I'm going to look at your conjunctiva. They're pink. They're not. They don't show any signs of swelling or sagging. I don't see any drainage, any watery eyes or dry eyes or anything like that. So next, his eyebrows. His eyebrows have evenly distributed hair, and his eyelashes are appropriate. No, they're evenly distributed across his eyelid. There's no swelling in his eyelid. He does have a little bit of hooding on his eyelid, but nothing that's obstructing his vision or anything like that. Okay, so now I'm going to have you look straight at me. I'm going to shine the light here. I just want you to look right at me, okay? So the corneal reflex, it's even on both sides. I can see the light even on both sides. So next I'm going to check your vision range of motion. I just want you to look straight ahead at this pin light, okay, and follow it with your eyes without moving your head. Good. Okay, so his eyes move along with the pin light. Well, no problems, no lagging or anything like that. So next I'm going to check for accommodation. So I'm going to have you look at my finger here, and then look at the far wall, and look at my finger again. Okay. So his accommodation is equal and appropriate on both sides. Next, I'm going to check I'm going to check for like stratus and stuff like that. So we're going to do the cover test. So what I want you to do is cover one eye, and while you look at me, okay? So I'm going to cover one eye. Okay. Okay, so no lazy eye, no stratus, nothing going on. They stay where they're supposed to. So next I'm going to have you read this. This is a Snellen eye chart. So I'm going to hold it. It says 6 feet away, and I'm going to ask him to read the smallest line that he can with this chart. Okay, so about 6 feet away. If you could read the smallest line that you can.
LTFPN.
Okay. So you got most of it right there. It's in letters. All right, I want you to cover your right eye and try again. Cover your right eye. Your other right.
LTFPN.
Okay, cover your left eye and read the chart.
LTFPN.
Okay.
It looks like an H now that I can look at it.
Yeah, it's an H. So, but that's close. I mean, it's pretty good. So you don't wear glasses or contacts or anything like that?
No.
You do not. Good. Well, your vision's pretty good. So next we're going to do, I'm going to take a look in his eye. Ophthalmoscope. So I'm going to be looking for the fundus, see if I can see the retina and all that. Okay? So I want you to look just right here. Okay? I'm going to check the other side. Okay. All right. Well, I don't see any problems. I don't see any retinal tearing or anything like that. Uh-oh. Wait an hour. So his eyes look pretty good. So next I'm going to move on to the ears. So I'm going to check the outside of your ear, and then I'm going to look in the inside of your ear. So I'm palpating the outside, looking for masses, bruises, lesions. I don't feel any, I don't see any deformities, no scars, right? I'm going to check the other side. No masses, no lesions, no scarring, no bruising, right? They're not tender. No, good. Okay, so now I'm going to grab my otoscope. Okay, and I'm going to look inside his ear. So we're going to start with this ear. Okay, I'm going to pull it back and up to straighten out the canal. Okay, so there we are. There's the tympanic membrane. I see this pearly gray. I don't see any cerumen blockage. There's no bulges. I can see the bony prominence. Okay. It looks healthy. There's no fluid buildup or bulging or anything like that. It's a pearly gray color and no problems. I don't see any drainage, nothing like that. So now I'm going to check this other side. So I'm going to pull up and back for the ear canal, just straighten the ear canal. I'm going to take a look here. Okay, so there's the tympanic membrane. No cerumen buildup, pearly gray in color. No problems here either, no bulging, nothing like that. Okay, so next we're going to do the whisper test. So I'm going to stand about 2 feet away from him. I'm going to cover my mouth so he can't see, and I will say a word and ask you to repeat it, okay?
Sounds wonderful.
Okay, so repeat after me if you can hear it.
Apple pie.
Good. Okay, we're going to check this other side.
Cinnamon stick.
Good. Okay, so he hears me really well. No problems with hearing. So next we're going to do the Weber and Rhine test. So I'm going to use this. I'm going to place it on your forehead right here, and I want you to tell me which ear you hear it most in, okay? So
It's the same.
it's the same in both ears? Good. So next we're going to do the Rhines test. I'm going to place this on the back of your ear right here. And I want you to tell me when you can stop hearing it, right?
Okay.
Can you hear this?
Yes.
Okay, good. Okay, then we're going to do it on the same thing on this side. So tell me when you stop hearing it.
Okay.
Can you hear?
Yes.
Okay, so you can still hear the tones. Good. So that means he doesn't have any air or bone conduction hearing loss. All right. So next we're going to do, so I'm just going to check my notes here. We did the ones that I wrote down earlier at the beginning, just simple little notes. So next we're going to check your nose. Okay, so next we're going to check inside your nose, all right? So I'm going to use my otoscope again to check inside your nose. So I'm looking at the outside structure of the nose. I don't see any deformities, no bumps. He does have a pretty straight nose. So I'm going to lift up here. If you could lean your head back a little bit, I'm going to lift the nose here. Okay, I don't see any drainage. His nose, his septum is pretty straight. Okay, and I don't see any blockages, no polyps, anything like that. His coloring is good. I'm going to come to this side and check this side of your nose. Lean back. Okay, so again, lean forward just a little bit. Okay, your nose looks good. The coloring is good. No drainage, no leakage, no bulges, no polyps. Your septum looks straight. So I'm going to occlude one side of your nose. I want you to take a breath in through the opposite nostril. So I'm going to occlude this side, breathe in through this side. Okay, no problems. I'm going to occlude this side, breathe in through this side. Good. So no problems breathing through your nose?
No.
Good. So next we're going to do the throat and tonsils. So I am going to use gloves for this part of the exam.
Okay.
So this I'm going to use my pen light. So I'm going to, when I first come in, I'm going to look at his lips. I'm going to note the color. His lips are red. They don't have, not like dark red, but light red. I don't see any blue tinge or anything like that. No cracks or lesions on his mouth. They do look symmetrical. I don't see any swelling on one side or anything. So go ahead and open your mouth. Say ah, wide open. So I'm taking a look. He's got all his teeth in place. You do have a couple fillings in the back. On the back right side, the back two teeth, I see a couple of fillings. Okay. No redness, no bumps, no lesions. Okay, I'm going to push down. I want you to stick out your tongue. I'm going to push it down. I'm going to look at the back of your throat. Say ah. Good. The uvula is raising. Okay, the back of the throat. I'm sorry. Does it still have taste bad? No. Okay, so the back of the throat, the uvula is raising. I don't see any redness, drainage, anything like that in the back of the throat. The tonsils are not swollen. I can see them on both sides, but they're not swollen. And his tongue is, I'm just going to wrap your tongue. Stick out your tongue. I'm going to feel for any, nothing like that. And there's no fissures. I'm going to look at the bottom of your mouth. Lift up your tongue. Okay, the mouth floor, and I'm going to feel your hard palate. Okay? All right, so no problems there. So, next, we're going to do the lymph nodes. I'm going to check your lymph nodes. And we're going to start, so I'm going to feel around your lymph nodes, okay, on both sides. So we're going to start with the pre-auricular. We're feeling with the pads of the fingers. Post-auricular. Okay. The occipital. Okay. The posterior cervical. Posterior cervical. The cervical up front. Anterior cervical. I don't feel any. Okay, next is tonsillar. So just look forward. I'm going to feel on both sides. Tonsillar. Submandibular. So these are all feeling great. No, they're non-fixed, non-tender. Tell me if you feel any pain or anything. This is the submental. Okay, good. And then this is the superior cervical. Okay, no problems here. And then we're going to do the epitrochlear. is right here. Okay, and I'm going to feel for it on the other side. Okay, and the axillary. Okay, so I don't feel any problems with this lymph nodes. No tenderness, no problems, non-fixed, not enlarged. Okay, so next I'm going to check his thyroid. I'm going to look at his neck. I'm going to check and listen to his thyroid, and I'm going to check his carotid pulse. So I'm going to check the carotid pulse. I'm going to do one side at a time. And then for the thyroid, I'll feel, move, and then also check his trachea to see if it's straight and all that. So first we're going to start with the carotid pulse. I'm going to feel on either side. Okay, good. Okay, now we're going to listen to it. Make sure we don't hear any bruise. Okay, good. So now I'm going to come behind him to check for his thyroid. So I'm going to feel on either side. There it is. Okay, take a swallow. Okay. So his thyroid is non-enlarged. I don't feel a gritty texture, anything like that. It's symmetrical on both sides. Neck, throat, tonsils. Next, we're going to go on to the chest. So I'm going to listen and feel your heart pulses, and then we're going to listen to the lungs next. So first we're going to start with the heart. I'm going to first listen to the aortic valve. It's in the second intercostal space on the right side, right sternal border. So S2 is louder than S1, it's more prominent. I'm going to listen to the pulmonic artery next, the pulmonary artery. Okay, and then we're going to go down to herbs. Next, we're going down to the tricuspid. And last, we're going to listen to the mitral. So this is the midclavicular line on the right side, fifth intercostal space. Very good. Okay, so he does not have any S3 or S4 noises, no gallops, no murmurs. It's a normal rate and rhythm for his heart. All right, so next I'm going to listen to your breath sounds, right? Starting with the front side, and then we'll move on to the back. Okay, so I want you to take deep breaths in and out when I say to, right? If you do need a break, if you start to get lightheaded or anything, let me know, and we'll take a break. So first, we're going to start off on the front. Good. Deep breath. We're gonna go to the back. He lifts it up. Sit up straight for me. Okay. Deep breath. Deep breath. Again. 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 One more time for this side. Okay. So I don't hear any adventitious breath sounds. No wheezing, no rhonchi, no crackles or anything in his lungs. He's denied trouble breathing, denied breathing problems, conditions, asthma, COPD, and all that earlier in the subjective assessment. So I'm going to look at his. I apologize, I'm on call 24/7. So I'm going to take a look at his chest. His chest is symmetrical on both sides. There's no dip. It's not concave or convex. I don't see any barrel chesting, no barrel chest, and it moves evenly. No accessory muscle used when he breathes. His breaths are unlabored and regular. Right. Okay. So next we did the. So while I'm on the cardiac, I'm going to check your pulses. So we did the carotid pulses on either side. Next, I'm going to look feel for your temporal artery. Okay. Next, I'm going to check for the brachial. The radial. Okay. I'm going to check on this side. Brachial. Radial. Good. So now I'm going to check the dorsal pedis. Can you take off your shoes for me, please? So we're going to check the dorsal pedis.
Can I put my shirt on? It's cold.
Sure.
Unless it helps you.
We're going to pull it up later when we do the abdominal assessment. Let me check this side of your foot. Okay, and then I'm going to do the posterior tibial. They can't see what I'm testing. So dorsal pedis here, posterior tibial is here. And I'm going to check it on this side. Dorsal pedis is here. Posterior tibial is here. Okay, so his pulses are present on all sides, and then they're not weak, they're not thready, they're even, and all of that. So next, we're going to check your abdomen. So I'm going to ask you to move to the couch, and I will move the camera closer to you so you can still see.
Do I need to take off my pants?
Huh?
Do I need to take off pants and shirt again?
No, I'm just going to lift up, if you could lift up your shirt until about halfway so I can see your abdomen, and then have it lay down here. Lay down on the couch. So, lay down on your back. So I'm going to assess your abdomen. I'm going to pull up your shirt here. So first we're looking at the contour of the abdomen. We're looking at coloring. So I do notice there's no discoloration on the abdomen. It is even on both sides. I do see a scar on your umbilicus. What is this from? This scar?
Oh, it's a scratch.
A scratch?
Yes.
Okay, did you have to have stitches or anything?
No, super glue. It was fine.
Super glue from home, okay. Okay, so the abdomen is not distended, it is symmetrical. I don't see any bulges or anything else besides the single scar on his umbilicus on the right side. So first I'm going to, it's not discolored, not yellow, nothing like that. So first I'm going to check your abdominal sounds. I'm going to listen in on all 4 quadrants, starting on this side and going around, okay? Huh?
Okay.
Okay, so we're going to start out. Okay, moving up. On to the left upper. Lower. Left lower. Okay, so his bowel sounds are normal active. I can find them in all 4 quadrants. They're present in all 4 quadrants. I'm going to listen to your epigastric region. Okay, so I don't hear anything abnormal there. So next I'm going to do a light palpation. I'm checking for tenderness and then superficial lumps or masses that I can feel. So I'm going to start over here. I'm sorry, I'm going to start with percussion. So I'm going to percuss and listen to the sound that I hear in each quadrant. So we're going to start on the right lower quadrant. Okay, it's a normal resonance. I'm going to go up. Okay, so I do feel hear the dullness at the liver. Ends about 3 centimeters below the rib cage. On the right. On the right upper quadrant. I'm going to move on to the left upper quadrant. And I just feel normal, hear normal resonance there. And then normal resonance on the right lower quadrant. So now I'm going to palpate all 4 quadrants for tenderness. Light touch, right? Okay, so I don't feel any masses. Any tenderness or pain when I push on your belly?
No.
No? So now I'm going to do deep palpation to check. I'm going to check for the liver, I'm going to check for spleen, and I'm going to check for kidneys. So first, we're going to start on the right side, checking for the liver. Deep palpation, I'm going to start on the lower right side. Any tenderness? No? So here, upper right side, I'm checking for the liver. I'm seeing if I can feel, relax your stomach. Okay, so I do feel the edge of the liver. It's not enlarged, not tender. I'm going to go to the left upper side, left upper region to check for the spleen. And I don't feel the spleen here. Next I'm going to check for kidneys. So I'm just going to support the back. Let's see if I can feel the kidneys. Can't feel them. Okay, so I can't palpate the kidneys either. Do you urinate normal?
Yes.
Any problems with urination, frequency, or pain? No. And do you pee a lot at night?
No.
No. Do you have any trouble emptying your bladder? Like it starts and stops when you urinate?
Yes, everything's correct with my pee.
Okay, good. All right. What about your bowel movements? Do you have regular bowel movements?
Yes.
Okay, so no, how often do you have a bowel movement?
Twice a day.
Twice a day, and it's regular consistency?
Yes.
Good. Okay, I'm going to have you sit up, lower your shirt here so you're not cold. So, no abnormal findings on the abdominal assessment. So next we're going to assess your skeletal muscle. So I just want you to turn around, face this way. So I'm looking at, I'm gonna raise your shirt again, please. Okay, so I'm gonna assess the spine. Relax your arms to your side. Okay, and I want you to bend over at the waist. Okay, so his back is even and straight. I don't see any curvature of the spine, anything like that. Okay, sit up. All right, so next I'm gonna watch you walk just a couple steps. Normally, please. Okay, so gait is even and steady, no problems. Posture is good, no slumping, anything like that. Come on, sir. So I'm gonna have you raise your arms above your head. Ooh. Good, and down. I'm gonna have you turn your arm in a circle. Good. So then I'm gonna have you, please stop. Okay, and then I'm gonna have you lift your leg up and stand for a couple seconds. Good, no problems. And I'm gonna have you turn your leg out. Like lift and turn. Good, to the other side. Okay, good. So any problems? Can you go into like a squat for me? Good.
Yeah, yes, the floor slipped.
Slippery, okay. But your knees are, no pain in your knees or your joints, no problems. Okay, I want you to lift your leg and move your ankle in a circle. Move your ankle like this. Good, and the other side. Okay, no problem. So now I'm gonna do passive range of motion. So I'm gonna lift his arm up. I'm gonna bend his elbow. I'm gonna check your wrists. And your fingers, can you open and close them? Okay. Okay. I'm gonna raise your arm. Bend your elbow, no problem. Move your wrists, fingers. Good, and let me do it. Good. Okay, so we're gonna move the computer back so we can have you sit in the chair so I can check your deep tendon reflexes. Okay, so I'm going to grab my hammer. And while we're doing this, I'm going to put it down a little bit more so you can see his legs and stuff. So we checked range of motion, passive and active. I'm just going to move your knee, make sure your legs passive motion, and your foot and your ankles. Good. Here. Let me do it. Here, just relax your leg. Okay, and your foot. Good. Okay, so next we're going to check the deep tendon reflexes. So we're going to start with the tricep. So I'm going to hold it here, rest your arm, relax, relax. I'm going to hit it on the back, and we're looking for movement of the tricep muscle here. Okay, we're going to do the other side. Relax, relax, relax. Okay, so you do know it's moving there. Next, we're going to do the brachial. So I'm going to hold your arm right here. Relax, relax, relax. Okay, we're going to do it this side. Relax your arm. Okay, now we're going to go to the radial. I'm going to be about here. We're looking for movement in the thumb. Okay. Relax. Okay. So next we're going to go to the patellar deep tendon reflex. So I want you to just relax your leg. Let me hold it, okay? Relax it, relax it. We're gonna strike here. Oh, that was good. Okay, and we're gonna go to the other side. Relax, rest, relax. Oh, well. Okay, good. Next, we're gonna check the Achilles tendon deep reflex. So for that, I'm gonna have you raise your foot up. I just want you to relax your foot. I'm gonna support it here, and we're checking for a movement of the foot. Okay, and check the other side. Relax, relax. Okay, so the foot just taps like that. Next. So next we're going to go over the cranial nerves. So I am going to use them. I wrote them down earlier at the beginning of the exam on my single note pad. So the cranial nerve number one. Cranial nerve number one is olfactory. So we did ask the patient about sense of smell, if he had any problems. He said you don't have any problems with smell. That's cranial nerve one. Not a lot we can do to test for that today. Two is optic. Cranial nerve two is optic, and we tested that when we had tested his vision with the Snellen chart. Ocular motor is cranial nerve number three. We tested that when we tested the 6 cardinal directions of eye movement. Trochlear, cranial nerve number 4, we also tested when we did the 6 cardinal directions of eye movement, and as well as cranial nerve number 6, abducens. We checked that also with the 6 cardinal directional move. Cranial nerve number 5 is trigeminal, so I'm going to check that by palpating the patient's mastoid muscle here and ask him to open his jaw. Okay, close. Good, so it's opening and contracting evenly on both sides, so that's the trigeminal cranial nerve. Number 7 is the facial, so I'm going to ask him to smile, big, wrinkle your forehead, and frown. Good, so that's cranial nerve number 7, facial. Cranial nerve number 8 we tested when we did the whisper test. The whisper test, cranial nerve number 8 is acoustic. Cranial nerve number 9 is glossopharyngeal. We did that one when we looked at the back of the throat when we had him say ah, the uvula raised. That means cranial nerve number 9 is intact, the glossopharyngeal. Number 10 is the vagus. So also when we had him, when we were looking at the throat, the raised uvula, that's the vagus nerve as well. When we're looking inside the mouth, the raising of the uvula. Cranial nerve number 11 is spinal. So I'm going to place my hands on your shoulders, and I just want you to press up, shrug up. Good. I'm pushing resistance, and he's able to raise his shoulders against pressure. Cranial nerve number 12, I'm going to ask you to stick out your tongue and move it from side to side. Perfect. Cranial nerve number 12 is intact. So, do you have any further questions for me? Anything else you'd like to add?
No.
All right, and that concludes our assessment. Thank you very much.
Bye.